Hey everyone, Dr. Aaron Moreland here with Fuller Health and Wellness Center in Eden Prairie. Yesterday I had two new patients. They were two young men. One was in grade 7, the other one was in grade 5. And the reason that their parents brought them in was that they had just finished the football season and they were kind of banged up from the football season. So they wanted to get them checked to make sure that there wasn't anything specific going on. Both of them though were complaining of having some neck pain, okay? And so I started doing the exam on the one that was in the young man that was in grade 7. And one of the tests that I'll do is just looking at range of motion. It can tell me a lot. So one of the things I'm looking for is how flexible they are. Maybe they're really tight and that can tell me a lot about what their problem might be coming from. Or maybe they're actually too mobile and that can also tell me what's going on. And so one of the tests I do is I just have them bend forward and then I had them bend back, okay? And so when I had this young man bend backwards, this is what it looked like, is he could not bend just straight back. And so I asked him, I said, do that again, but try to move this side too. And he could not. And so what that told me is that something was preventing him from being able to bend back, obviously. And so one of the muscles that is in that front of the spine that could potentially be hindering that would be a muscle called the psoas muscle. Psoas muscle attaches from here, comes down into the pelvis, and then you have the muscle called the iliacus. So it's actually called the iliopsoas muscle that attaches, and it's a hip flexor, bends the leg up, but it also can help with bending the spine and such. And so this was actually preventing him from being able to bend backwards. And so then when I had him lie on the table and I checked the psoas, significant difference. He could see it significantly as well, or feel it significantly as well, that when I worked on this side, nothing. When I worked on this side, very tight. Now, when I was doing the history with him, he told me that he had a neck issue. I said, is there anything else that you're dealing with? He said, no, I don't feel anything else. And so here he is dealing with a health issue that he has no idea that's going on. And so, and his dad was in the room and he saw his son not be able to do that too, and kind of shocked him as well. Now, let's say you don't do anything about that, that's never found. That is going to cause a problem later on, whether it's in his next season of football, or maybe he's playing basketball in the winter. Maybe it shows up there, or maybe it shows up 5 years later. And the reason it shows up is he keeps pulling his hamstring because this SI joint, this pelvis isn't moving the way it's supposed to because this psoas is tight. And then everybody will say, oh, there's something wrong with your hamstrings. He had very tight hamstrings, so they'd probably, oh, you just got to stretch your hamstrings. And so the big takeaway is that you don't know what most of the things that are going wrong in your body until they go wrong far enough that they start to cause pain or somewhere else starts to cause problems. And the thing is, if you would have got that checked out months, weeks, even years ago, that could have prevented that. And that's why prevention is such a better way for health. And that was why I just love that this dad and mom brought their kids in, not because they're necessarily thinking they needed a bunch of care, but because they wanted to make sure that they were doing good after that football season. So again, my name is Dr. Aaron Moreland with Fuller Health and Wellness Center in Eden Prairie. We see a lot of kids in our office, and that's the reason we see them, is it's a lot easier to take care of it now versus when they're 20, 30, 40, 50 years old and the problem's been there many years. So hopefully you're having a great day. God bless.